Muscle Doctor, hi, it's Liam here today, and I'm so glad that you could join me for a closer look at the muscles of the upper limb. So let's dive straight in. Starting superficially and superiorly, we're going to begin with the deltoid muscle. So at the deltoid, we have anterior fibers, posterior fibers, and lateral fibers. Not to be confused with, and often mistaken as, medial fibers. I think people get confused and think this is the middle part of the deltoid. They're not medial, they're lateral. Lateral fibers of the deltoid. So this fairly vast muscle is the most superficial of the upper arm and the shoulder joint, and it goes from the spine of the scapula, the acromion, and also the clavicle. And all of those fibers come down to insert onto the deltoid tuberosity of the humerus, which is just around there. As we take that most superficial layer off, you can see that. Very similar to glute med of the hip, but this one with the shoulder. And there are lots of similarities with upper limb and lower limb, which we are going to reference fairly frequently today. So at the upper limb, we've got that ball and socket joint similarly of the lower limb. So with the head of the femur in the acetabulum, we've also got the head of the humerus in the glenoid of the scapula. The deltoid, similar to glute med in the way that posterior fibers are going to extend the humerus as well as laterally rotate. Anterior fibers, no prizes for guessing then that it's going to flex the shoulder or flex the humerus and medially rotate. And then the lateral head of the deltoid is going to abduct the arm. So that is the most superficial layer. As we strip that one off, you can see there's a lot going on underneath. The rotator cuff, which we're not necessarily going to cover today, there's a separate video for that which you can find on my page. We go inferior or inferiorly from the deltoid, and we've got a group of muscles that most of us know here. These are the biceps brachii. So what does that name mean? It's biceps, there are two heads, and it's of the arm. And we call it that, biceps brachii, because biceps femoris would mean two heads of the leg, which is very similar in the way that it flexes the knee, in the same way biceps brachii flexes the elbow. But it doesn't just flex the elbow, it also acts on the shoulder, and it can act on the shoulder because it crosses the shoulder joint. If it crosses the shoulder joint anteriorly, it's probably going to flex the shoulder joint or bring it out to the front. So biceps brachii flexes the shoulder, flexes the elbow. It also supinates the wrist or the forearm. And if you do it yourself, you supinate the wrist now with the elbow flex, you can just see that last little bit of shortening and contraction of the biceps brachii. So biceps, there are two heads, and at the moment we've only really looked at one, which is the long head. And it's called the long head because it is the longer of the two. It comes around through the intertubercular or bicipital groove, depending on where you read it, which is a common area for inflammation of that tendon. And also if you're doing massage in that area and you're putting pressure down into the anterior deltoid or through deep enough to get to the long head of the bicep tendon, it's going to be painful. And the reason it's painful is because there's nowhere for it to go. It's just going to get squished into that little space and it's going to irritate it and probably not do anyone any favors. So follow that up around this absurd right angle and we come into the top of the glenoid. So that is the top of the socket. So often surprising, this muscle with the route that it takes and the length of it, that would be the long head. The short head inserts onto the coracoid process, which is that projection just there of the scapula. So an anterior projection, again, a painful spot. If you're working into the upper pecs, anterior deltoid, that is going to cause some pain because it does sit quite superficially. Biceps brachii inserts there. Or they originate there, I should say, and as they come down, they join into one common insertion, which is the radius and the aponeurosis of biceps brachii. Bicipital aponeurosis. Aponeurosis just means broad, flat tendon. So let's strip some of those layers off and we can see there's another muscle in there that comes from the coracoid process and it inserts onto the arm, the humerus or the brachii. And I say it like that because it's called coracobrachialis, which is potentially a wordy name, but you break the word down, it's coracoid process onto the brachii or the arm. So what do we think that muscle does? If it shortens, it pulls insertion closer to origin, it's going to adduct and flex the arm. So bring it in and out to the front. Don't forget about that one. Easily forgotten about, little coracobrachialis. We've got the triceps on the posterior aspect of the arm, but in between the two, we've got another muscle just in here, which is the brachialis. So that muscle's similar in function to the biceps brachii. It flexes the elbow, but the difference here is that to activate and recruit this muscle, we need a pronated grip. So that's going to be a hammer curl kind of movement with a neutral palm and neutral wrist. It's going to recruit that muscle a bit better. Don't forget, if you're trying to build big guns, brachialis sits in between biceps and triceps, and developing that muscle can push them out to the side. So don't forget your hammer curls. Round to the posterior aspect, we've got the triceps. If biceps means 2 heads, triceps is going to mean 3. And that muscle we break into 3 parts because there are 3 heads. We've got the lateral head, we've got the long head, and we've got the medial head, or brachii medius as it calls it here, but it's the medial head. They all insert onto the olecranon process of the ulna, which is just there into the triceps tendon. That is the boniest part of your elbow. It's the bit where if you're a massage therapist, you're inflicting pain, or should I say healing people, that is the part that you're doing it with for the most part. That's the olecranon process of the ulna. So the lateral head and the medial head, they only act on the elbow, they're at the back, they extend the elbow, they straighten out the arm. But the long head is called the long head for a reason, because that again crosses the shoulder joint. So much like biceps brachii, but instead here it goes to the infraglenoid tubercle. I'm going to take some layers off there. We can't see it, but it's just under there. We can zoom. So that little projection at the bottom of the socket of the shoulder. So of course it acts on the shoulder. If biceps brachii, long head, flexes the shoulder, then long head of triceps brachii is probably going to extend the shoulder, isn't it? And that's exactly what it does. So it extends the shoulder, it also adducts the shoulder joint, and it extends the elbow. So there we have the upper arm. Now we're getting into it because we're moving below the elbow. So again, think about that lower limb. When you look at the upper limb, we've got the 2 bones of the lower leg, tibia and fibula, and we've got the 2 bones of the distal arm, which would be the radius and the ulna. We've got the femur of the leg, and we've got the humerus of the arm. So you can start to see similarities. When you understand one joint, you probably start to understand the other a bit better. So a lot of the muscles now that we're looking at in the wrist, we'll call it, or the forearm, we've got muscles on the ventral aspect. And I call it the ventral aspect because if I call it anterior, it can get confusing. In this position that we call the anatomical position, it would technically be anterior, but I'll call it ventral. Ventral, if you curl yourself up into the fetal position, is everywhere that's protected. Dorsal would be everything that's on display or vulnerable. So the ventral aspect. We've got a group of muscles here, most superficial if we remove the bicipital aponeurosis. We call those pass, fail, pass, fail. Because if you put your hand on to the ventral aspect just like that, we can list those with P, F, P, F. Pass, fail, pass, fail. So we're going to begin with pronator teres. No prizes for guessing what that muscle does. It pronates the wrist. And you can see as the insertion moves closer to origin, of course, it's going to rotate the arm that way, which is pronation. Pass. Fail. Flexor carpi radialis. Clues in the name. It flexes the wrist. It connects the radius to the carpal bones. And that comes on the ventral aspect. So it's also going to give us radial deviation, which is just a wave. It's one of the actions of the wrist. We've got flexion, extension. We've got radial deviation and ulnar deviation, sometimes called abduction, adduction, but that can confuse things. So we'll call it radial deviation. That's the F. Pass, fail, pass, palmaris longus. This is that muscle that we just don't think about. Even though it's superficial, it brings the palm into flexion. And then we've got flexor carpi ulnar. So it sits closer to the ulna, it flexes, and it joins the ulna to the carpal bones. So again, this gives us ulnar deviation. So the second part of that wave movement. So there's our pass, fail, pass, fail. And these are just 4 of the 10 flexor tendons that pass through the carpal tunnel, along with the median nerve. So you can see why sometimes people get carpal tunnel syndrome. It's the median nerve being impinged and squished by everything else that's going on in there. 10 tendons and not much space in some cases. We'll talk about that in a moment when it comes to the carpal tunnel and what exactly that is. So let's strip some layers off. And we've got more muscles underneath. Of course we have. So we have flexor digitorum superficialis. So this muscle, you can see, is a big muscle belly in there. And all you have to do is clench a fist, make a fist, and you'll feel those muscles activate. We need a lot of power in those fingers for our grip. And so that's the muscle belly that controls that via the tendons. And then on the deepest layer, we've got to strip everything off. We've got flexor digitorum profundus. It's profound, it's deep, and that's why it's called that. We've got the thumb muscles, which we'll get onto in a moment. Let's strip that one off. And there's this little tiny muscle in there that we call pronator quadratus. So it's a square shape, it's quadratus, 4 sides, and it pronates, it brings insertion closer to origin. So as we come round to, I guess you call it the lateral aspect, we call it the radial aspect. This is the radius here that inserts down into the thumb. And we've got some muscles that control the thumb. So we've got extensor carpi radialis longus. It's a wordy one, but everything is when you get down to this end of the arm. There's so much going on in here. Not going to pretend that I did that on purpose because I didn't. So abductor pollicis longus. So we call the big toe the hallux, and we also refer to the thumb when it comes to muscular anatomy as pollicis, and it abducts the thumb. So it brings it out like that. Have a closer look at where those tendons go. The reason will become apparent because we've got extensor pollicis longus as well. And so we've got that muscle there. We've got abductor pollicis longus there as well. Those two, when contracted, and you can do that by just bringing that thumb into that kind of position. You can see it there on me. That forms, I kid you not, what we refer to as the anatomical snuff box. And people used to take tobacco up their nose, they call it snuff, and they would put it within that little bit there and snuff. So we call that the anatomical snuff box. You may have heard of de Quervain's tenosynovitis. It's that scrolling kind of overuse of those tendons, and it's those tendons there that get irritated and inflamed. We've also got this little muscle around the side there, which is extensor indicis. So we have one muscle just for extending that index finger. So obviously the importance of that. If you're ever using your thumb to scroll, try a finger. Get extensor indicis itis. Not yet a thing. I'm sure it will be at some point in the future. On the subject of little muscles, I've got to show you this one because it's abductor digiti minimi, which is a muscle just for abducting the little finger. If you forget what it's called, just think mini-me. Not a hard one to remember. So we've looked at the flexors, ventral aspect. Now let's look at the extensors on the dorsal aspect. And remember, some of the major flexors that we had were flexor carpi ulnaris and flexor carpi radialis. So we've got extensors that do the same thing. Extensor carpi radialis longus. So there's a little one in there as well, which is the brevis. This extends the wrist, which is that. It connects the carpal bones just down here to the radius as well. And there's brevis, his little helper, just along the side. I do tend to forget about that one. Got to build some layers up there as well because we've got extensor carpi ulnaris. So we've got fewer extensor tendons than we have flexor tendons, which is the theme throughout the body because extension tends to leave us exposed, flexion tends to bring us into a more protected, less vulnerable position. You can guess the insertions to that. I won't bore you. Then just on the side, we've got the flexor carpi ulnaris, which we covered already. So a few other tendons in there as we remove some of the layers. I'm going to have to fish these ones out. Can you see just how much is actually going on inside there? So there's the thumb and finger muscles. These ones we call those the lumbricals. Well, we used to call them the lumbricals. Maybe I've got to add some layers. Well, there's all sorts of muscles in the hand, just like there are with the feet that adduct and they bring the fingers together, and they abduct, they bring the fingers apart as well. But there's one muscle that we haven't yet covered, and I'm wondering why, because we kind of missed that one out. And it would be just there. Brachioradialis, so one of the more superficial ones that we're more likely to encounter and actually be able to palpate. This flexes the elbow. It doesn't only pronate but also supinates, depending on the position of the arm. And what I will say about elbow and wrist supination is that you can supinate and pronate at both joints. It just depends which one's fixed. If the wrist is fixed, the elbow is going to pronate, supinate. If the elbow is fixed, the wrist will pronate and supinate. The last thing that I want to mention then, this is about the carpal tunnel. So the carpal tunnel, what is the carpal tunnel? Well, we've got these carpal bones at the deepest layer there. One of these bones is called the hamate, which would be that one just there. Can you see that hook? We call that the hook of the hamate. So the carpal tunnel, that's one part. The other part would be the flexor retinaculum, which is just there, flexor retinaculum of the wrist. So it's that little tunnel. I can zoom in. Yeah, it's that little tunnel just through here. If I start to add some tendons, come on, please work. There we go. So there is the hook of the hamate and the flexor retinaculum. All those tendons pass through there, along with the median nerve. Where are you? There you are. Is that it? Yeah. So sometimes that can get a bit impinged in there and a bit unhappy and not much room for movement. And that will give us neural sensations down into fingers, thumb, first, second, and half of the ring finger phalanges. Anyway, we're not here to talk about injuries, are we? Thank goodness. That's the anatomy of the upper limb. A brief look at the muscular anatomy and some neural and some injury pathology as well. But I hope it's been helpful for you. And I would love to hear your comments. Please like and subscribe, helps the channel, and that helps me produce more of this type of video, which I hope are helpful for you. Thanks for watching.